It's not been seen before. It's a new phenomenon in humans. And we don't completely understand the pathophysiology yet, although what we're looking at, what I've got here is based on reputable sources. The Centers for Disease Control and the Lancet are publishing studies of the coronavirus and what people experience when they have it. So this is a novel coronavirus, meaning it's never been seen before. Apparently, I believe at this point they believe that the current idea is that it came from bats. It changed to be able to move from bats into humans and then has spread around the world, making people very, very sick. Most of the time people aren't getting very sick with it, but people do get very sick with it occasionally, and we're trying to keep our healthcare system from being overwhelmed. So just to sort of review the manifestations, classic manifestations are dry cough and a fever, and then people start developing respiratory distress. Can be a productive cough. This can progress to dyspnea, acute respiratory distress syndrome, and then possibly death. So here's where the concept of gas exchange comes in. Coronavirus, although there have been some discussions about GI symptoms associated with this virus now, most people don't have GI symptoms. Some of them do, but primarily the people who get very sick with it, their breathing gets worse. And what happens, if you look at the slide that we've got on the screen now, you see the basic anatomy of the lung there. You've got the bronchioles leading to the alveoli, and the alveoli are the little air sacs, if you remember. And we've got capillaries around each of the alveoli. That ball there next to the alveoli to the left looks at normal gas exchange. You can see that there's the area inside the alveoli, and then there's the inside of the alveolus, and there's the lining between the alveolus, and which is the individual alveoli, and the capillaries. It's a thin membrane. It's a permeable membrane, and as you can see, the yellow oxygen arrow goes into the blood, and the green CO2 arrow releases CO2 out of the blood across that membrane and into the alveolus, and then you would exhale and the air goes back out. This is associated, remember the three parts of the concept of gas exchange: ventilation, transport, and perfusion. So which one do you think this is? This is why I prefer live meetings. But anyway, this is obviously ventilation. Air goes in and out. Air goes in and out, and once it goes through the bronchi and into the alveolus, we hope that the alveolus has good permeable membranes in order to make that CO2 go out of the blood and the O2 go into the blood. Now, on the right-hand side of the screen, you're going to see a picture of what happens when the inside of the alveolus becomes inflamed. The lining of the alveoli are all inflamed, and you can see the thickening membranes there. If you notice the difference in the boundaries between the alveoli, between the left and the right. On the right-hand side, you see the white walls between. That's representative of the thickening of the membrane. It makes it harder for the oxygen to get into the blood and harder for the CO2 to get out of the blood. You notice that whole membrane is very thick there. I'm going to go to the next slide now. This kind of breaks it down a little bit more. And you can see that the normal alveolus on the left has a membrane, has a lining around the membrane. There are white blood cells that get in and out of that area in order to destroy bacteria before they get to be a problem. And you can see the capillaries there come very close, just on the other side of the membrane. You see those red blood cells in there. That's the transport. And of course, the oxygen is trying to get across the membrane to lodge onto those red blood cells and be transported to the tissues. That third part is perfusion, if you remember. So on the right, you're going to see an an injured alveolus during the acute phase. So this is someone with acute respiratory distress syndrome, or ARDS. You can see that the alveolus is filled with fluid, that the membranes around it are a lot thicker, and that there's inflammation between the alveolus and the capillary, and there's a lot of white blood cells in the capillary. There's fluid leaking out of the capillaries, contributing to the swelling and making it a lot more difficult for oxygen and CO2 to cross that membrane and result in ventilation. So this is a short and sweet summary of the worst case scenario with coronavirus. Just remember, most people don't get this sick. In fact, many people are asymptomatic. That's actually what makes this disease harder to fight, because of course people are passing it to each other without even knowing it, which is why we are now all stuck in our homes, staying away from each other. So keep yourself safe. Don't panic. If you develop a dry cough or a fever, contact your physician. And this is the advice that you should be giving to people. Of course, all the bit about washing your hands and controlling infection, but also take care of your own immune systems. If you do get sick with this, it's quite likely that you'll be just fine and you won't need to be hospitalized. So you just want to stay away from your friends and family if you do. And anyway, we're all staying away in order to flatten the curve and help people be healthier. So I hope that you're healthier, and I hope this lecture didn't ramble too much, and I'm going to post some more lectures. Thanks.